So yes, there are less invasive methods. One of the ones that's currently being used is something called trans-nasal endoscopy. And what that is rather than put the patient to sleep in order to do an endoscopy, the patient's completely awake. You numb up the nose and the nasal passages and the back of the throat, and then you introduce a very, very small, thin ear, nose, and throat derived scope through the nose down into the esophagus. It has a single channel in it, so you can take biopsies. It'll only allow you to identify the esophagus and survey that. But the procedure takes 10 minutes. You pull out the scope, the patient can get up and walk out, go home. There's no sedation, there's no anesthesia. It's been tried in kids less than up to 11 years of age, so beyond 11 years of age. And the more experienced centers are trying to bring it down into younger kids. We can do things like put them into goggles for virtual reality or Google glasses to view a movie, and they seem to tolerate the procedure very well. So this is something that's in practice now. It's not available at every center, but it's going to become more popular as time evolves. Other things that are in development are something called the string test. This is a capsule that has essentially a piece of dental wax that you might floss your teeth with, coiled up inside. You swallow the capsule, and you tape the string to the side of your mouth, and then the capsule essentially unrolls the string. You let it sit in the esophagus for a certain period of time, and then you just pull it out. And then you take this sticky string and you take the segments that have been sitting in the esophagus, and you can analyze it for eosinophil-derived proteins and mediators. To date, it seems to correlate very well with the biopsies taken from various portions of the esophagus. It won't be a way to diagnose the disease, but it may be a way to follow therapy and or survey the patients rather than going through endoscopies. So that holds great promise. A similar kind of approach is something called the cytosponge, in which it's a capsule that expands upon being in liquid, and it creates a corrugated sphere that you swallow, it opens up, and then you pull it out, and it kind of scrapes the lining of the esophagus. And again, it creates little pieces of tissue that the pathologist can then look at under the microscope, looking for eosinophil proteins and looking for eosinophils themselves. That seems to be very well tolerated. It sounds kind of archaic, but it seems to be very well tolerated by patients. And again, rather than even the string test, it has to sit down there for a period of time. This is instantaneous. You swallow it, it sits there for a few seconds, you let it open up, you pull it out, and you're done. So hopefully these things will prove to be valid ways of monitoring the disease process. And once they're validated, they'll be commercialized and available for centers to use.